Welcome to the Noted Pharmacist, your trusted platform for high-quality pharmacy and medical education. Today, we'll explore antianginals, the drugs used in the management of angina, and provide a detailed overview of their mechanisms and therapeutic applications. Don't forget to check out our companion video featuring a 10 MCQ quiz for revision, with the link available in the description below. By the end of this video, you'll have a comprehensive understanding of the pharmacology of antianginal drugs. First, you'll learn the definition of angina and how it develops and its underlying pathophysiology. Second, you'll explore the classification of antianginal drugs and their clinical roles. Third, you'll understand the mechanisms of action of nitrates, beta blockers, and calcium channel blockers. Fourth, you'll recognize key indications and the therapeutic benefits of these medications. Fifth, you'll grasp treatment guidelines and how various antianginal agents are integrated into clinical practice. Lastly, you'll identify major safety considerations, including contraindications and drug interactions for antianginal therapy. With these objectives in mind, let's delve into a detailed description of angina and its pathophysiology. What is angina? Angina pectoris, commonly referred to as angina, is a clinical syndrome characterized by chest pain or discomfort due to myocardial ischemia, typically triggered by physical exertion or emotional stress. It often presents as chest pressure, chest tightness, or a burning sensation, occasionally radiating to the neck, jaw, or arms. The pathophysiology involves an imbalance between myocardial oxygen supply and demand, commonly due to atherosclerotic coronary artery disease, CAD. This condition reduces blood flow to the heart muscle, particularly during times of increased oxygen demand. Angina affects millions worldwide, with a significant prevalence in older populations and those with cardiovascular risk factors such as hypertension and diabetes. Its impact on quality of life is profound, causing physical limitations and psychological distress. Treatment goals for angina. The primary objectives of managing angina are to alleviate symptoms, improve functional capacity, and reduce the risk of clinical events such as myocardial infarction. Treatment focuses on both immediate symptom relief and long-term prevention of ischemic episodes. Achieving these goals involves optimizing myocardial oxygen balance while addressing underlying conditions like hypertension or hyperlipidemia. Patient education and adherence to lifestyle modifications are integral components of successful management. Pharmacological therapy plays a central role in managing angina by relieving symptoms and improving myocardial oxygen supply-demand balance. Medications target mechanisms like coronary vasodilation, heart rate reduction, and reduced myocardial contractility. Importantly, pharmacological interventions complement lifestyle changes and revascularization procedures for comprehensive management. Let's look at classification of antianginals. Drugs used to treat angina can be broadly classified into primary and secondary classes. Primary classes include nitrates, beta blockers, calcium channel blockers, and potassium channel openers. These drugs aim to relieve angina symptoms and improve oxygen supply to the heart. Nitrates like nitroglycerin and isosorbide dinitrate, along with beta blockers like atenolol and metoprolol, reduce heart workload. Calcium channel blockers, including amlodipine and verapamil, relax blood vessels to improve blood flow. Potassium channel openers such as nicorandil and minoxidil enhance coronary circulation effectively. Secondary antianginals support primary therapy by addressing underlying causes or improving heart function. Antiplatelets like aspirin and clopidogrel reduce clot formation, while anticoagulants such as warfarin and apixaban prevent thrombi. Ranolazine, a metabolic modulator, optimizes energy use in the heart. Let's now look at the mechanisms of action and indications for antianginal medications. We will start with nitrates. Nitrates play a pivotal role in the management of angina, offering both acute relief and long-term prevention of recurrent episodes. They alleviate chest pain, prevent attacks, and improve exercise tolerance. Their mechanism hinges on the release of nitric oxide, which triggers vasodilation, including significant venodilation. This dual action reduces preload and afterload, effectively lowering myocardial oxygen demand and alleviating the cardiac workload. Beta blockers. Beta blockers are a cornerstone in managing stable angina, primarily due to their ability to antagonize beta-adrenergic receptors. By reducing heart rate, blood pressure, and myocardial contractility, these agents effectively lower myocardial oxygen demand during physical exertion, mitigating ischemic episodes. For instance, metoprolol, a cardioselective beta blocker, is widely used to optimize symptom control and improve exercise tolerance in angina patients. Calcium channel blockers. Calcium channel blockers play a critical role in managing both stable and variant angina by inhibiting calcium influx into vascular smooth muscle and cardiac myocytes. Dihydropyridines, such as amlodipine, exert their effects predominantly through vasodilation, alleviating myocardial oxygen demand. In contrast, non-dihydropyridines, like verapamil, reduce heart rate and myocardial contractility, making them particularly effective in cases requiring heart rate control. Potassium channel openers. Potassium channel openers play a pivotal role in angina management by inducing vasodilation through the activation of ATP-sensitive potassium channels, resulting in smooth muscle relaxation. This dual mechanism improves myocardial oxygen delivery while reducing cardiac oxygen demand, making them effective in preventing angina episodes. A notable example is nicorandil, which combines potassium channel activation with nitrate-like vasodilatory effects for optimal therapeutic benefit. Ranolazine is an antianginal agent indicated for refractory angina, functioning as an inhibitor of the late sodium current in cardiac cells. This mechanism attenuates intracellular calcium overload, a key contributor to myocardial ischemia, thereby reducing myocardial oxygen demand without significantly altering heart rate or blood pressure. Its unique action makes it particularly beneficial in patients with chronic angina unresponsive to standard antianginal therapies. Now, let's explore the treatment guidelines for managing angina. For the management of stable angina, the BNF guidelines emphasize nitrates for acute symptom relief and beta blockers as the cornerstone of long-term therapy. Beta blockers, such as bisoprolol or atenolol, are preferred due to their efficacy in reducing myocardial oxygen demand through decreased heart rate and blood pressure. The table presented here is just to summarize the BNF guidelines for first-line stable angina management. It highlights drug classes, examples, mechanisms, and measurable clinical effects critical for decision-making. Second-line therapy for angina includes calcium channel blockers like amlodipine, which reduce myocardial oxygen demand and enhance coronary perfusion, particularly when beta blockers alone are insufficient. Long-acting nitrates, such as isosorbide, improve coronary blood flow but require a 12-hour nitrate-free interval to prevent tolerance. Ranolazine, a late sodium current inhibitor, decreases anginal episodes by approximately 30%, offering significant symptom relief. Nicorandil, a potassium channel activator, combines vasodilation with ischemic relief, providing a versatile option for refractory angina management. Pharmacokinetics. Let's review the absorption, distribution, metabolism and excretion of antianginals, mainly focusing on nitrates. The absorption of nitrates is rapid and varies depending on the formulation. Sublingual nitrates, such as glyceryl trinitrate, have a fast onset of action, entering the bloodstream directly via the mucosa. However, oral formulations undergo significant first-pass metabolism, which reduces their bioavailability, making them less effective when used orally compared to sublingually or via patches. In terms of distribution, nitrates are widely distributed across tissues, including the heart, where they exert their therapeutic effects. They have a moderate volume of distribution, VD, indicating that they are well distributed to the tissues. Glyceryl trinitrate is also highly protein-bound, which influences its pharmacokinetics and duration of action. Metabolism of nitrates primarily occurs in the liver, where glyceryl trinitrate is converted into inactive metabolites. This process contributes to the drug's relatively short half-life, necessitating frequent dosing or the use of sustained-release formulations for prolonged effect. The liver enzymes involved in this process can be inhibited or induced by other drugs, potentially affecting nitrate efficacy. Nitrates are excreted predominantly through the urine as inactive metabolites. Given their high first-pass metabolism and rapid elimination, dosing must be carefully adjusted to maintain therapeutic efficacy. Renal function should be monitored in patients with impaired kidney function to avoid accumulation. Now, let's examine the safety profile of antianginal medications, focusing on their side effects, important warnings, contraindications, and potential drug interactions. Common side effects of nitrates include headaches, dizziness, and hypotension. Headaches often result from vasodilation, particularly when the drug is initiated or dosages are increased. Hypotension occurs due to systemic vasodilatory effects, and patients may experience dizziness or fainting, especially when standing. Beta blockers can lead to bradycardia, fatigue, and cold extremities due to their negative chronotropic and inotropic effects. These effects can be particularly troublesome in patients with pre-existing conditions like heart failure or diabetes. Additionally, beta blockers may worsen asthma symptoms due to non-selective beta receptor blockade, although cardioselective agents may reduce this risk. Calcium channel blockers may cause peripheral edema, constipation, and dizziness. Dihydropyridine calcium channel blockers like amlodipine are less likely to affect heart rate but can cause significant swelling of the lower extremities. Non-dihydropyridines, such as verapamil, may lead to bradycardia and exacerbate heart block. Special caution is needed when prescribing nitrates to patients with hypotension, dehydration, or those on concurrent antihypertensive therapy. Overuse or abrupt withdrawal of nitrates can result in tolerance, reducing their effectiveness. Patients with severe hepatic or renal impairment may require dose adjustments. Beta blockers should not be used in patients with asthma, second or third degree heart block, or severe bradycardia. They can worsen symptoms of peripheral vascular disease and may mask hypoglycemia in diabetic patients. Monitoring blood glucose levels is essential for diabetic patients on beta blockers. Calcium channel blockers, especially non-dihydropyridines, should be used cautiously in patients with heart failure or atrioventricular block. Their effects on heart rate and contractility can exacerbate heart failure in patients with left ventricular dysfunction. Monitoring for bradycardia and heart block is essential. The table presented here is a concise reference on calcium channel blockers' warnings and precautions. It highlights adverse effects, contraindications, and key patient-specific monitoring needs. Nitrates can interact with sildenafil, tadalafil, and other PDE5 inhibitors, causing a significant drop in blood pressure. When combined with antihypertensive drugs or vasodilators, the risk of hypotension increases. Alcohol can potentiate the hypotensive effects of nitrates. The table presented here is a concise overview of critical nitrate interactions and associated risk metrics. It highlights severe hypotension risks when nitrates interact with PDE5 inhibitors, antihypertensives, vasodilators, or alcohol. Beta blockers may interact with drugs affecting heart rate or blood pressure, such as calcium channel blockers or antiarrhythmics. They can reduce the metabolism of drugs like digoxin, increasing the risk of toxicity. Care is needed when combining beta blockers with drugs that affect blood sugar levels. The table presented here is a concise representation of beta blocker drug interactions. It outlines clinical effects, risk metrics, and drug examples to emphasize key concerns. Calcium channel blockers, especially non-dihydropyridines, interact with drugs affecting cardiac conduction, like beta blockers or antiarrhythmics. They can also increase plasma levels of drugs metabolized by the cytochrome P450 system, such as cyclosporin or statins, leading to toxicity. The table presented here is designed to elucidate key drug interactions involving calcium channel blockers, especially non-dihydropyridines. Lastly, let's look at emerging therapies in angina treatment. Emerging therapies for angina include novel drugs like ivabradine, known by its brand name Corliner. Ivabradine selectively reduces heart rate by inhibiting the IF channel in the sinoatrial node without affecting blood pressure. This makes it particularly beneficial for patients with heart failure. Unlike traditional beta blockers, ivabradine minimizes adverse effects like hypotension, making it a promising addition to angina management, especially in patients intolerant to conventional therapies. Recap. Now that we've explored the topic of antianginals, let's take a moment to recap. We've covered how angina develops due to an imbalance in myocardial oxygen supply and demand. We also discussed the classification of antianginal drugs, including nitrates, beta blockers, and calcium channel blockers. Additionally, we explored their mechanisms of action, such as reducing heart workload or increasing oxygen supply to the myocardium. We highlighted the key indications for antianginal drugs in relieving and preventing ischemia. You've also learned about treatment guidelines and how therapies are combined for optimal management. Finally, we examined the contraindications in drug interactions that must be considered in clinical practice. In conclusion, understanding the pharmacology of antianginals is vital for managing angina effectively and improving patient outcomes. These medications play a pivotal role in reducing symptoms, preventing complications, and enhancing quality of life for those with coronary artery disease. Be sure to check out our next video on drugs used in heart failure, where we'll discuss their mechanisms, therapeutic applications, and clinical significance. For further reading on antianginals, consult these trusted resources. Katzung and Trevor's Clinical Pharmacology for detailed drug mechanisms. Rang and Dale's Pharmacology for foundational concepts and clinical applications. The British National Formulary, BNF, for up-to-date guidelines and practical prescribing information. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.